All right, so this is for Form 12. This is for the form called the Lab. So the two roles that I played were Kim, the PhD student, and then Beth, the RIO, or Rio, as she called it in the video. So with Kim Park, there was definitely some ethical issues that were going on. There were multiple ethical issues, but one that I want to mention is that she definitely had a situation going on with Greg, and Greg took her data and took the numbers and skewed them in favor of his journal article. And when he brought the paper to her and asked her to review it and sign it, she signed it before she really looked at it, which she probably shouldn't have done. And then after signing it and seeing the published journal article, she realized that the numbers were skewed in favor of his article. And so that brought up the ethical question of whether or not she should report Greg for doing that in the journal article. And she debated, for a few reasons. One being that she worked closely with Greg. Greg was somebody that, gosh, I can't remember the guy's name, but one of the supervisors, Greg was like the golden child or whatever within the lab, and he always produced good work, and he was kind of a star within the lab, and she knew that if she reported him, that it would make waves and cause problems, and that because she is a student and a PhD student, that maybe not everybody would believe what she was saying was true. So she had to figure out within her own self whether or not she wanted to report Greg. And she did, and it caused problems. She ended up having to switch labs. So with Beth, my second role, I played Beth, and she was the RIO. And the ethical issue right off the bat with her that I saw immediately had to do with her dad being in a position of authority, and the current officer leaving his position, and her dad pressuring her to take the job and saying that she'd do a good job at it, even though that she thought that she may be unqualified for the position. And so taking that job and then diving into that job, she realized that, with the meeting with her, with the previous person in that position, that he really didn't do much. He didn't create any, foundation for her to jump into that position and really be well trained or understand what the expectations are for her to really make a difference in substantiating claims of misconduct. So that's definitely an ethical issue there. So both of the scenarios and both of the roles connect to protecting human subjects and maintaining research integrity, because both scenarios are the same story of unethical behavior. It's just from different points of view. And they both present a choice that needs to be made, and multiple choices really in each scenario of how to respond to each portion of that situation ethically, and what you would do, and how each choice that you make can create a different outcome. So having someone falsify research data and being involved in whatever position you are, whether it's the student that sees the data and knows that the data has been skewed, or the officer who needs to then investigate those people, and you're in a new position investigating those people, that all can create ethical situations that make it hard to make a decision, especially if it's going to affect you and your personal life and your goals. With Kim, she made a decision and she ended up having to leave and switch labs because she got ostracized for being a whistleblower. And I think in an everyday job, that's something that you have to really think about, because people make mistakes and everybody's human, but people who purposely do things and hide things, especially at an advantage to themselves, you risk a lot by bringing up that type of stuff to somebody who's going to investigate them, and you open up yourself to being finger pointing for causing problems. So, and I think that's all across life, not just in evidence-based practice or research, but in every life, job, statistical, political situation. So, yeah, okay. So the connection I see and how it affects someone in healthcare would be, and the use of evidence-based practice would be how it implements policies in patient-centered care in real life. So, if data is skewed and people lie and journal articles are produced based on data that is not true, you have people in healthcare like nurses and groups who are trying to change policies, and they change policies based on the evidence-based practice journal articles that they're researching and the data that they believe is true. They are changing policies to hopefully create better situations and better healthcare and safety for their patients, and they're doing that based on false data. So it really truly isn't helping their patients. So I see that affecting multiple people in healthcare if that was the situation. So that's my video.